Okay, let's get into this. Think about needing, serious healthcare.
Right.
Maybe it's complicated or just super expensive where you live, maybe not even available. Well, for millions of people, that actually means traveling. Going across borders for treatment, it's not some tiny niche thing anymore.
No, it's huge. A massive global industry.
Mm.
Complex, too.
Yeah, maybe you listening, maybe you know someone who's thought about it or even done it.
It's this really interesting mix, isn't it? You've got personal health needs, serious ones, bumping up against international travel, logistics, economics.
Totally, you really have to see all those pieces to get it.
Exactly.
And that's what we're doing today, a deep dive into medical tourism.
Yep.
And we're focusing specifically on India. We're using insights from a really detailed conversation we had with Danish Ahmed. He's the CEO of healthtrip.com.
Right. And he's an interesting figure, an entrepreneur who jumped into this whole medical space after some pretty big successes in e-commerce.
Yeah, quite the shift. So our mission here really is to walk you through what we learned from him.
What's the situation right now with medical tourism in India? What are the opportunities? I mean, the big ones.
And the challenges too, right? The roadblocks.
Definitely the roadblocks. And also, what does it actually take to build a business in this? Boots on the ground, we're seeing it through his eyes.
So think of this as your guide, your informed take on this whole sector. We've waded through the source material and we're pulling out the key bits for you.
Let's start with Danish Ahmed himself. Because his journey, well, it tells you a lot.
He's a 3-time entrepreneur, 2 exits already, 1 to Flipkart, 1 to Payteam.
Pretty impressive. And he built India's first $100 million fashion e-commerce site. I mean, that's a very different world from healthcare.
Totally different. And what really came through in the conversation was why he shifted.
Yeah, what drove that change?
He talked about e-commerce success, but feeling like something was, missing.
Like not having that direct positive impact on people's lives?
Exactly. Not in that really profound way. Selling stuff is one thing.
Right. But helping someone navigate a serious health issue abroad, that's different.
Yeah, so he saw medical tourism as, he called it the best of both worlds.
Makes sense. The chance to build a proper, scalable business, something he clearly knows how to do, but tying it directly to making a real difference, helping people when they're really vulnerable, getting their blessings, as he put it.
It was a big leap, though. A whole new field. He mentioned needing 4 years just to learn the ropes.
Okay, so let's scale up. How big is this whole thing?
Yeah.
Globally. And where does India fit?
Right, the numbers.
Yeah.
Globally, the source put the wider tourism industry at maybe $400 billion. Huge.
Wow.
But medical tourism, the specific slice we're talking about, that's around $80 billion.
$80 billion. That's still massive.
How many people?
Something like 15 million people traveling across borders for treatment every single year.
15 million. Okay. And India's share?
The published figures suggest India's market is around $6 billion. Okay, $6 billion. How does that break down?
Well, based on the conversation, it's roughly split 3 ways. About $2 billion is pure medical tourism surgeries, treatments.
Yeah, right.
Another $2 billion is from Ayurvedic and wellness tourism, traditional Indian medicine, well-being stuff.
Right, the Ayush part.
And the final $2 billion, that's what these tourists spend on flights, hotels, food, everything else while they're in India.
So it all adds up. That $6 billion makes sense.
Yeah, it's a decent chunk of the global pie. But he also pointed out something interesting.
What's that?
That there isn't really a single huge global company dominating this space right now. No big player solving the whole puzzle.
So fragmented. Big opportunity, maybe.
Seems like it. Which brings us to, okay, if India has the $6 billion market, who exactly is coming? Where are they traveling from?
That's key, and the source was very specific on the medical patient side.
Where's the biggest flow?
About half. Fully half of the medical patients coming to India are from Bangladesh.
Wow, half from just one country. That's concentrated.
It really is.
Yeah.
Beyond Bangladesh, you've got significant numbers from Iraq, the Maldives, Oman,
Okay.
then the CIS countries. That's the former Soviet republics, basically. And yeah, Russians are part of that now, too. Plus Myanmar, Fiji, Seychelles, and then a big chunk from various countries across the African continent.
So quite spread out geographically apart from that big Bangladesh corridor.
Yeah.
What about for the wellness side? The Ayurveda tourists?
Slightly different mix there. Primarily GCC countries.
Yeah.
Saudi Arabia, UAE, that region.
Right. The Gulf states.
Also Europeans and Russians again. So some overlap, but wellness seems to pull a bit more from Europe and the Gulf.
Okay, so people are coming, lots of them, from all over.
Yeah.
But It doesn't sound like it's exactly smooth sailing. What are the big hurdles India faces, the challenges compared to competitors?
Yeah, this is where it gets tricky. India's main competition here, it's countries like Turkey and Thailand.
Okay.
And the conversation really highlighted some, well, pretty major disadvantages for India at the moment.
Like what were the biggest pain points you mentioned?
Visas, number one, huge issue. Getting a medical visa for India, especially from key places like Bangladesh or Pakistan, it can take 1 to 2 months, minimum.
Months. Wow.
Yeah. Now compare that to Turkey or Thailand. According to the source, a patient from, say, Nigeria could find out they need treatment today.
And fly out when?
Tonight.
Yeah.
Like literally be on a flight the same evening because the visa process is just so fast, so easy.
That's a staggering difference, especially when health is involved. Time is critical.
Absolutely critical.
Yeah.
And then there's the money issue, forex norms.
Currency exchange stuff.
Yeah. In Turkey, you can easily wire funds to your facilitator to cover costs, all above board.
But in India?
It's difficult. Often patients have no choice but to travel, carrying huge amounts of physical cash.
That sounds incredibly risky.
It is. Danish mentioned incidents of patients getting robbed. It happens almost every week. Think about the damage that does to India's reputation.
Yeah. Terrible. Stressful for the patient. Dangerous. Just bad all around.
Exactly. And then there's the structure of the industry itself within India.
How so?
He described it as highly disorganized. Very few certified players, maybe only 20 or 30 he mentioned.
Meaning?
Meaning basically anyone can hang up a sign and say they're a medical tourism facilitator, which leads to really inconsistent service quality, bad experiences for patients.
Unlike Turkey or Thailand, where there's more regulation.
Right, where you often need some kind of certification to operate. So you have these big hurdles, slow visas, risky cash handling, a fragmented, disorganized industry.
Okay, so given those problems, what needs to change? What are the fixes, the policy shifts?
Well, top of list, according to the conversation, is bringing back the old e-visa system, the one they had before COVID.
How did that work?
He described it as patient sends medical reports in the morning, gets the visa invite by evening, maybe travels the very next day.
That sounds like the kind of speed you need.
Exactly. It tackles that biggest bottleneck head on.
What else? What about when patients actually arrive?
They need proper facilities at airports, specific desks or areas for medical tourists, people who can answer questions, guide them.
Makes sense, like a welcome point.
Yeah. And a government website, a central place with reliable information, and crucially, a way to file complaints or give feedback, a grievance mechanism.
Okay. And the cash problem.
Needs a proper policy, some safe, official way for patients to handle funds without carrying stacks of cash.
These all sound like practical fixes. What about promoting India? Competing globally?
Yeah, that's key too. The government needs to back companies that are promoting India, help them attend international medical tourism conferences, offer incentives.
Like subsidies.
Exactly. He mentioned Turkey gives apparently a 70% cash back on marketing spend to its medical travel companies. India needs something similar to level the playing field.
Right. Is anything positive happening on the policy front? Any good signs?
Yes. One thing was highlighted as very, very positive. That's the NABH certification for Ayush hospitals.
Ah, the quality standard for Ayurveda and traditional medicine.
Right. Getting that formalized is seen as a really good step. And there's also some hope pinned on this new Healing India Mission initiative.
What's the hope there?
That it might help speed up getting these other necessary policy changes, like the visas and forex, actually put into place.
Okay, let's talk COVID. Obviously, huge disruption to travel.
Massive impact. Yeah, the industry took a big hit, lost business.
Was the recovery?
Quite dramatic, actually. The hospitals involved in this, they're apparently doing 220% of their pre-COVID numbers.
220%? Wow.
Yeah. And Health Trip itself, doing double their pre-COVID business. He used the phrase, come back with a vengeance.
That's serious growth.
It is. But he also added a caveat.
Which was?
That the growth could have been even stronger if things like the visa issues had been fixed sooner. There was apparently a lot of pent-up demand from people who just couldn't travel during the pandemic years.
Right, a backlog of patients. Makes sense.
Okay, so people are coming back in big numbers. What are they coming for? What treatments are most popular now? Has it changed?
Yeah, he said there's been a definite shift since before COVID.
How so?
Pre-COVID, orthopedics was apparently a really high-volume area. Joint replacements, things like that.
And now, what's driving the volume?
Currently, the big ones are cardiac heart procedures, cancer treatments, IVF, organ transplants, and neurological issues.
So Pretty serious, complex stuff.
Very. Though he did mention spine and neuro are still high-volume areas, and IVF is picking up very well.
Is India known for being particularly good at certain things? Like a specialty?
Yeah, according to the source, India is considered best in cardiac and cancer and transplants across Asia.
That's a strong reputation to have in critical care.
Definitely a major draw.
Okay, let's switch to the money side again. Insurance. How does that work? Are these international patients usually covered?
This was really interesting. The reality right now, about 96% of patients pay out of pocket.
95%. So almost everyone is using their own savings or maybe loans, not insurance from back home.
Pretty much. But he framed this as a huge untapped opportunity.
An opportunity for whom?
For Indian insurance companies. There's massive potential for them to actually sell health insurance policies in neighboring countries.
Ah, okay. Like in Bangladesh or Nepal.
Exactly. Places where India is often the default destination for serious medical care anyway.
So you'd buy a policy in Bangladesh, specifically designed to cover your treatment if you need to go to India.
Precisely. It would make accessing that care much easier, financially less stressful, no need for the suitcases of cash.
Yeah, I can see how that would be valuable.
And the idea is Indian insurers could partner with platforms like HealthTrip to sell these policies abroad.
Which would bring in foreign exchange for India.
Yep. And channel more patients through organized routes. A win-win, potentially.
Sounds logical. So thinking about HealthTrip, building their business, how do they scale with all these challenges, the visas, the forex?
Well, one advantage they have is operating in multiple countries, not just India.
So if India's visa process is taking ages for a particular patient?
They can offer Turkey as an alternative. It gives them flexibility. He did say they prefer bringing patients to India, but they have options.
So the hurdles slow things down, make patients hesitate, but don't completely stop their business.
Right. But despite that friction, their growth seems, well, pretty fast.
How fast?
He said they'd grown about 8 times in the last 9 months. Described the scaling as going well.
8 times. That's significant.
And their ambition is huge. The goal, to become the largest global medical travel platform, they feel they're racing towards this.
Did he give any, hard numbers, targets?
Yeah. Expected to close this year, 2025, at around $18 to $20 million in business, aiming to double that next year. And the big goal, reach $1 billion in business over the next 5 or 6 years.
$1 billion.
Yeah. His view is clearly that the opportunity exists. The market is big enough.
Okay, so let's circle back. We have the visa hassles, the cash risks, the disorganization. Why do people still choose India through all that?
This was a really core point. It boils down to one word: quality.
Quality of care.
Yes. India is just very well known and reputed for the quality of our doctors and the ethics of our doctors. Plus the best equipment, skilled nurses, the whole package.
And the ethics part seems crucial. That story about doctors advising against unnecessary surgery.
Yeah, that really stood out. Imagine traveling all that way, maybe with a scary diagnosis from home, expecting major surgery.
And the Indian doctor says, nope, you don't need this operation, medicine will do.
Right. He said it happens very often. Maybe 1 in 3 patients told they need surgery back home actually go back without having it after consulting in India.
That builds incredible trust, doesn't it? When the focus is genuinely on the right diagnosis, not just doing a procedure because the patient is there and can pay.
Absolutely. It creates this reputation that money just can't buy. He even mentioned patients coming to India to fix botched treatments they got elsewhere, like Turkey. His line was, "Nobody beats us in quality."
So that quality, that combination of skill and ethics, it's powerful enough to make people navigate all the other difficulties.
Seems to be the case. That's the main pull factor.
Okay, we've talked a lot about the medical side, surgeries, treatments, but what about Ayurveda and wellness? You said that's a $2 billion market already for India. What's the potential there?
Yes. This is seen as potentially much, much bigger, a multiple-fold larger opportunity than even the medical side.
Really? Why so much larger?
Because the audience is just vastly wider. Medical tourism targets that tiny fraction of people, maybe 0.2%, who need surgery.
Right, the acutely ill.
Wellness tourism. That appeals to a huge chunk of the population. People looking for stress relief, detox, weight loss, preventative health. People who aren't necessarily sick but want to stay well or improve their well-being.
So it's proactive health, not just reactive treatment.
Exactly. And think about the shift after COVID. Everyone's much more focused on health, wellness, immunity.
True. That trend is global.
So the belief is India could realistically attract huge numbers, maybe as many as 10 million tourists coming for these wellness treatments eventually.
10 million. That's a massive jump. Does India have a natural advantage here beyond the treatments themselves?
It does, culturally. India's global image, it's seen as a divine country, a place for spirituality, finding peace. Think Steve Jobs coming here.
Right, that whole association.
That existing brand is incredibly valuable and can be leveraged specifically for wellness tourism.
Are there challenges specific to the wellness side, though?
Yes. While the potential is enormous, the industry itself is apparently not as organized as the medical industry yet.
How so?
It needs more structure, more established chains of wellness resorts, perhaps, rather than just lots of individual smaller centers. Consistency is key.
But that NABH certification for Ayush hospitals you mentioned earlier, that helps.
Definitely. That's a step towards standardizing quality, which is crucial for building trust in the wellness space, too.
Okay, thinking about who succeeds in building these businesses. Is it better to come from healthcare or travel? Or maybe being an outsider, like Danish Ahmed, is an advantage?
It's an interesting question. He made the point that big disruptions often come from outsiders.
Like the Flipkart or PayPM examples he gave? People without prior retail or banking experience shaking things up.
Exactly. Outsiders can think outside the box, ask those why not questions about how things are done.
But surely industry experience helps too.
Oh, for sure. Different backgrounds bring different strengths. A healthcare background, obviously great for understanding treatments, guiding patients on doctors and hospitals. He mentioned HealthTrip does this, ranking doctors, helping patients choose.
Makes sense. And a travel background.
Probably helps massively with scaling fast. Existing networks, partnerships with airlines, hotels. Danish said HealthTrip gets a lot of patients via travel partners. That reach is vital.
So it's maybe less about which background is best and more about combining skills.
Seems like it. Collaboration is key, he stressed that. HealthTrip partners heavily for the travel logistics flights, hotels, because that's not their core strength.
They focus on the health side.
Right. And they even provide their tech platform to NGOs who help patients travel. It's about linking different expertise.
How does HealthTrip see itself then? What's their model?
They call themselves a full-stack medical tourism company.
Meaning end-to-end service.
Pretty much. From finding the patient online, giving treatment cost estimates, setting up teleconsults before they travel,
Right.
to airport pickup, managing the services during their stay, some outsourced, but they monitor it, even arranging medicine delivery.
So covering the whole immediate journey.
And now they're going beyond that, building out post-treatment services.
Like what?
Things like partnerships for specialized guest houses or hospices for recovery in India, but also digital support once the patient goes home.
How's that work?
Remote teleconsults, maybe with physios or dietitians, using devices to monitor health, connecting patients in online communities with others who've had similar experiences. It's about continuing that care relationship.
That makes a lot of sense. Extending the service beyond just the hospital stay.
We talked about quality being India's big strength. How important are the formal certifications like JCI or NABH for attracting patients?
He said, critically important.
Why so crucial?
Because the type of patient coming for complex care in India, they're often from the wealthier segments back home, the top 5 to 10%. They are actively looking for quality. They come for quality.
So they research this stuff, look for accreditation.
Absolutely. They look for those badges of quality, like JCI, that's the big international one, or major hospitals with the NABH certification, India standard. They're not just picking a hospital randomly.
And it's not just the patients themselves.
Right. Government sending patients or insurance companies potentially partnering, they often require these kinds of quality certifications too. It's fundamental for trust and for enabling those larger partnerships.
Makes sense. Where is HealthTrip focusing its efforts geographically right now?
India is still the main game. Over 90% of their business is focused on bringing patients to India. But they're looking elsewhere, too.
Yeah, they're building a presence in Turkey and the UAE as well, offering those as options.
And where are they getting most of their patients from, the source countries?
The key ones right now are Bangladesh, Oman, Uzbekistan, Kyrgyzstan, Nigeria, and Ethiopia.
Okay. Since Turkey is such a big competitor and seems to have figured out some things, what are the quick lessons India could learn?
The conversation was pretty blunt here. Turkey's beating India in many markets, except, notably, Bangladesh. The lessons are basically the flip side of India's disadvantages.
So copy what Turkey's doing right.
Essentially, yes, make visas easier and faster. Make transferring money, forex, smoother and safer. Mandate accreditation for the facilitators to ensure quality control. And provide real marketing support, like that 70% cashback Turkey offers.
It sounds like a classic trade-off for patients then. India might have superior medical quality and ethics.
Yeah, phenomenally good was the term used for India's quality.
But Turkey offers way more convenience, easier access.
Exactly. And if the treatment isn't super complex, maybe just sufficiently good quality combined with easy logistics is enough to sway a patient, especially if getting to India is a hassle.
So fixing those logistical friction points is crucial, even with the quality advantage.
Definitely.
Okay, summing up the roadblocks again. Beyond visas and forex, what else is holding India back?
Flight connectivity was mentioned. Not enough direct flights to some key source countries makes the journey longer, more complex.
And the cash issue we keep coming back to.
Yes, patients having to carry cash is just a big problem. Needs a real policy fix.
And the disorganized industry.
The lack of accredited companies. It leads to bad experiences, hurts the country's reputation, a bad name, as he put it. Plus, the lack of marketing support compared to competitors.
Got it. We've focused entirely on people coming to India. Does it happen the other way? Do Indians go abroad for treatment?
Yes, it does happen. Outbound medical tourism.
Where do they typically go, and why?
Usually places like the US, Korea, maybe Singapore. It's often for very niche, highly specialized treatments that might not be available in India yet. Health Trip isn't focused on that outbound market themselves, but they acknowledge it exists.
Okay, last question then. What's next for Health Trip? What's their focus?
Well, fundraising is always happening. They're working on their next round, have offers. But strategically, their focus is very clear. Go deeper into medical tourism only.
Just medical. Not diversifying into wellness, even though it's a huge opportunity.
Apparently not right now. His reasoning was there's just so much more to be done purely within medical tourism.
The market's that big.
Yeah, he threw out a number. Even if they were handling 10,000 patients a month, that's still only maybe 1% of the global opportunity. So the focus is just get more patients, sign up more top hospitals and resorts, they have over 300 now, and get better at matching patients with the right solutions. The growth potential just in that core area is still seen as massive.
Wow. Okay, that really covered a lot. A true deep dive into this space, pulling from that conversation. It did. We hit the market size, India's place in it, where the patients come from.
And got a clear sense of India's real strengths, didn't we? That reputation for quality, the ethics, that's huge.
Absolutely huge. But we also didn't shy away from the big challenges. The visas, the money handling, the need for more organization, more certification. Those are serious hurdles.
Yeah, and we touched on big opportunities too, like that massive wellness and Ayurveda potential. Plus, hearing directly from someone building a business in the thick of it, that perspective is invaluable.
For sure. So now you listening should have a much better handle on this whole complex world where healthcare meets travel meets business.
Right. And it leaves us with this final thought to chew on. India clearly has this amazing advantage when it comes to the actual quality of medical care and the ethical approach. So what's the missing piece to really unlock that massive global potential, both in medical and wellness tourism? Is it just about fixing those specific policies, the visas, the forex? Or does it need something deeper, maybe a fundamental shift in how the entire industry organizes itself and presents itself to the world?
Something to think